Hi guys, see you again on our channel. This time we will discuss ataxia. Listen to the end. Ataxia is a neurological disorder characterized by the inability to control muscle movements with good coordination. The term, ataxia, comes from the Greek meaning, inability to organize. The disorder can affect various parts of the body, including the arms, legs, trunk and head. Ataxia can be caused by a variety of factors, including genetic disorders, damage to the central nervous system, brain trauma, and certain medical conditions. Ataxia can be classified into different types based on its cause. Some types of ataxia include autosomal dominant inherited ataxia, cerebellar ataxia, and Friedreich's ataxia. Autosomal dominant inherited ataxia is the most common type of ataxia and is passed on through the problematic gene from parent to child. Symptoms usually appear in early adulthood and develop over time. People with this ataxia experience an inability to control their body movements with good coordination. They may have problems with balance, abnormal eye movements, poor motor coordination, difficulty speaking, and difficulty swallowing. Cerebellar ataxia is a type of ataxia that occurs when a part of the brain called the cerebellum is damaged or dysfunctional. The cerebellum plays an important role in controlling the coordination and balance of muscle movements. When the cerebellum is impaired, people with cerebellar ataxia may experience an inability to control hand and foot movements properly, poor motor coordination, difficulty speaking, and impaired balance. Friedreich's ataxia is a type of ataxia that is inherited in an autosomal recessive manner. It is the most common form of ataxia in children. It is caused by a mutation in the fractionin gene. Patients with Friedreich's ataxia experience damage to the spinal cord and peripheral nervous system, especially in parts of the body that experience a lack of blood flow. Symptoms include difficulty walking, muscle weakness, speech impairment, heart problems, and abnormalities in the nervous system. Symptoms of ataxia can vary from mild to severe, depending on the type and severity of the disorder. In addition to motor problems, people with ataxia may also experience sensory impairments, such as vision and hearing loss, as well as cognitive and emotional problems. Diagnosis of ataxia involves a thorough medical evaluation, including family history, physical examination, and ancillary tests such as genetic tests, blood tests, brain imaging, and electromyg beneath the skin surface, which sends electrical signals to evaluate muscle activity and nerve function. Other tests such as balance tests, coordination tests, and cognitive tests may also be performed. Treatment of ataxia depends on the cause and aims to manage symptoms, slow the progression of the disease, and improve the quality of life. In some cases, ataxia cannot be cured completely, but therapies and medical interventions can help reduce symptoms and associated complications. Pharmacological treatments may be used to control symptoms such as balance disorders, tremors and seizures. Physiotherapy, occupational therapy and speech therapy can help improve muscle strength, balance and movement coordination. Some sufferers may also need walking aids or wheelchairs to aid their mobility. In addition to medical treatment, lifestyle changes can also help manage ataxia. Regular exercise and physical therapy recommended by a therapist can help maintain muscle strength and balance. Patients may also need to avoid factors that worsen symptoms, such as alcohol, stress and certain medications. Psychological support and family support are also important for people with ataxia. Emotional and social support can help overcome feelings of isolation and depression often associated with this condition. Joining support groups or organizations that focus on ataxia can also provide an opportunity to share experiences, gain information, and get support from people facing similar conditions. Research is ongoing to better understand the causes of ataxia and develop more effective therapies. There are efforts to develop genetic therapies that aim to correct the genetic mutations that underlie some forms of ataxia. Stem cell therapy is also being studied as a potential method to regenerate and repair damage to the nervous system. It is important to recognize that ataxia is a complex condition and affects each individual in different ways. Treatment and management will be heavily influenced by the type and severity of ataxia, so it is important to consult with a specialist experienced in neurology or movement disorders to get the right treatment. In some cases, ataxia can affect the life expectancy and quality of life of sufferers. However, with the right support, proper treatment, and appropriate lifestyle changes, many ataxia sufferers can lead lives as productive individuals and maintain a decent quality of life. In addition, it is important to note that ataxia also affects the lives of the family and loved ones of sufferers. Emotional support, understanding, and patience from family and friends can have a significant impact in helping ataxia sufferers deal with daily challenges. In addition to the previously mentioned types of ataxia, there are also several medical conditions that can cause ataxia symptoms. For example, strokes, brain tumors, infections, deficiencies of certain vitamins such as B12, and side effects of certain medications can cause movement and coordination disorders. Prevention of ataxia is not always possible as many of the contributing factors are genetic or cannot be controlled. However, adopting a healthy lifestyle, maintaining a balanced diet, exercising regularly, and avoiding excessive alcohol consumption can help keep the nervous system healthy and reduce the risk of developing ataxia associated with these factors. In terms of research and development, efforts continue to understand more about ataxia and find new ways to diagnose, treat and manage this condition. Genetic research continues to identify genes associated with different types of ataxia and search for potential therapeutic targets. Clinical studies are also being conducted to test the effectiveness of new drugs and experimental therapies in addressing ataxia symptoms. In addition, patient organizations and communities continue to play an important role in raising awareness about ataxia, providing support for sufferers and their families, and mobilizing funds for further research and development. They are also a valuable source of information for individuals affected by ataxia, helping them to better understand their condition and deal with daily challenges. Overall, ataxia is a complex neurological disorder and can affect various aspects of an individual's life. While there is no cure for ataxia completely, the right therapy and support can help manage symptoms, slow the progression of the condition, and improve the quality of life of sufferers. Through continuous research and collaborative efforts, the hope is that in the future there will be more advancements in the diagnosis, treatment and prevention of ataxia. This is our discussion on ataxia. Thank you.